And welcome to the Dr. Bob Show. 1 out of 3 American adults have high blood pressure. Another 1 out of 3 have a blood pressure that's higher than it should be. And sometimes people don't know they have high blood pressure. They haven't had it recorded. They don't realize they're walking around with a time bomb. We'll be talking most of this show on high blood pressure, how harmful it can be to the body, and what we can do about it. My guest is Dr. Dan Ely. Dr. Ely is a board-certified internal medicine specialist. He's on the staff at University of Tennessee Medical Center. He'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about can high blood sugar damage the eyes, and not enough sleep. It can really be harmful to your body. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Dan Ely, board-certified internal medicine specialist on the staff at the University of Tennessee Medical Center. Dan, welcome to the Dr. Bob Show.
Thanks, Bob.
Tell me about high blood pressure. Why is it called the silent killer? Is that legit?
Yes, I think it is, because sometimes people will have symptoms when they have high blood pressure, but for the most part, they won't. They will not know at all.
So it can be there for a long period of time, causing damage, and people not know it?
Absolutely.
How do they find out?
They find out because they've stumbled into their doctor's office and maybe somebody's measured it, or maybe at Walgreens, or maybe because they've had a complication from high blood pressure.
Now, if somebody suddenly says, well, your blood pressure is a little high today, do they tend to try and push that aside, or does the doctor try and say, hey, we need to pay attention to this?
I think it's well to pay attention to blood pressure that's a little high, even if it's high normal in that pre-hypertension phase, because we know that that can go on to be higher and higher, and over time definitely contribute to some bad problems.
So tell me, what is a normal blood pressure?
Well, if you wanted to say technically, normal is less than 120 and less than 80. But
when you say less than 120 and less than 80, what are you talking about?
The systolic and the diastolic blood pressure.
What's the systolic? Let's go through that.
Well, when your heart, which is a pump, when it squeezes and pushes blood out through the arteries, that pushes blood out and that increases the pressure. And
so that's
that
the highest
upper
pressure.
Number, that's systolic pressure.
Okay, that's systolic.
And then your heart relaxes so it can fill with blood again. And during that period when it's relaxing, that's diastole. That's the diastolic pressure in the blood vessels where the blood isn't being pushed through them.
So 120 over 80 is quote, quote, normal?
Yes, and that's pretty much what we would consider kind of ideal, you might say. But we don't really talk about high blood pressure until it's about 140 and 90.
So what if somebody has a low blood pressure, let's say 100 over 60, is that bad too?
Well, it depends on the situation. There are a lot of younger folks running around out there, especially young women, who naturally have low blood pressures. And if they feel well, that's good. But if you are getting older and you've got some other medical issues, that's a blood pressure that I'd be concerned about because it may lead to some trouble if it's too low. Absolutely.
So if somebody has a blood pressure that's 140 over 92, both numbers are elevated, what do you do?
Well, if it's the first time they've been in, I would talk to them about their blood pressure, assess what their risks are for having cardiovascular disease and complications. And we, of course, want to get more information. We want to get more blood pressure readings. So we would rarely do anything based on just one blood pressure reading. We want to understand if that's a typical blood pressure or if that maybe is just high that day.
Is it good for a patient if they've got that one elevated blood pressure recording to get a blood pressure cuff for home so they can take it at home and they can come into the doctor's office and say, hey, here are my recorded blood pressures?
I think that is a good thing because it's pretty clear that blood pressure readings at home, if done correctly, which is an if, are perhaps more important than the ones we get in the office because there's more of them and it's during a typical routine.
So how is a blood pressure taken correctly? You made that statement pretty strong.
Yes, person should be relaxed. They should be sitting down, both feet on the floor, arm approximately heart level. And again, relaxed. Don't run around and sit down and take it. You want to wait about 5 minutes. Best blood pressure is going to be taken on the upper part of the arm, not in the wrist, not in the finger. And it should be by a reputable machine. You can get that over the counter in, at Walgreens or other.
Yeah, I've got an Omron IntelliSense that I use at home, and it's a digital readout. And I try and sit up straight, put both, and it's very interesting. If you cross your legs, or if your arm is not at heart height, it will change your recording. I've sort of played around with that. It's sort of interesting.
Well, I think that is interesting. And you do want to understand what things affect blood pressure, take multiple readings, get a sense of what the average is.
So if somebody has high blood pressure, what damage can it cause? If it's not treated adequately, how does high blood pressure damage the body?
Well, it basically puts more pressure on organs. And so the things we worry about are heart, kidneys, and brain, because high blood pressure leads to stroke, and nobody wants to have a stroke.
So what does high blood pressure do as far as stroke goes? Your blood pressure goes high and it just busts a blood vessel?
Well, that actually can happen, but more likely it leads to changes in the blood vessel over time that make it weaker, so that at some point you've got a blood vessel that just isn't as flexible and distensible and is more likely to either clot or to rupture.
And that is everybody's fear, that they have a stroke and it's left them as a quote vegetable, not able to perform, not able to do what they want. So high blood pressure, untreated, unknown, can lead to stroke. What does it do to the heart itself?
Well, the heart is that pump, and the heart has to pump against the pressure that's in the arteries. So if there's more pressure in the arteries, makes sense the heart has to work harder, and over time it can give out, it can fail.
So it gets tired.
It gets tired.
Does it get bigger? Like if we lift weights, does the heart actually get bigger at first and then tires out?
Absolutely. The heart is muscle, and it will thicken. And that might sound like a good thing, but it's actually not. You want that muscle to be nice and flexible and compliant.
So we've got damage to the heart, we've got damage to the brain. How are the kidneys affected?
Well, in a similar way, the pressure that goes to the kidneys affects their function, and so it leads to ineffective kidney function.
So it's very, very important that people recognize high blood pressure.
Absolutely.
And they get it treated. Treatment effective for them?
The good thing is, yes, treatment is effective, quite effective.
Now we'll talk about that later on. Tell me about abdominal aortic aneurysm. I want to just switch to that because that's one of the problems with high blood pressure.
Okay, well, the aorta is the major blood vessel that comes off of the heart, and it can enlarge, and if it gets an abnormal swelling in it, kind of like a balloon, that's an aneurysm. And that can happen just because of bad luck, but it can happen because of extra pressure in the arteries as well.
So high blood pressure is a very, very dangerous thing. At what age should people start getting their blood pressures?
Well, I'm not a pediatrician, and it is recommended that children have their blood pressure checked at some point in there, and they do. But I think any young adult should know what their blood pressure is.
And the numbers, the classic numbers, because, I've asked at home, what's the normal blood pressure, just to check and see if people knew, and 120 over 80.
120 over 80 is
now,
a great blood pressure.
If it's 125, is that bad?
Well, it's not bad, but that does land you in this area called pre-hypertension. And if your blood pressure is higher than 120, we know that over time it's likely to go higher yet. And we also know that the higher your blood pressure is, even if it's 125 compared to 115, that leads to more problems down the road.
So it's important to know your blood pressure to be sure that you have the opportunity of getting it corrected. Is the treatment good?
Treatment is excellent.
And that's what we're going to be talking about when we come back. If treatment is excellent, what is it? What's the first thing we want to do? Second thing, third thing? To save our lives. A lot of information. You want to stay tuned to this. We're talking with Dr. Dan Ely, board certified internal medicine specialist. We've been talking about hypertension, high blood pressure, normal value, quote, quote, 120/80. If it is abnormal, it can lead to problems in the brain, stroke, problems with the heart attack or heart failure, and problems with the kidney, chronic kidney damage. Dan, let's talk about treatment. You said treatment is really very, very good. If somebody has an elevated blood pressure and you've documented that 2 or 3 times, how do you start treatment?
Okay, good question. And depends on how severe the blood pressure is. If it's really high, I'm going to put somebody on medicine. But if it's not so high, if it's 140 over 90, something like that, and I would like to give them an opportunity to make some changes in their life that can help their blood pressure. And if you want to talk about those things, I want to get them to cut down on their salt intake.
Is that easy for a person to do?
Well, not always, because salt is everywhere in our diet,
Yeah,
and you really have to be careful about it.
But is salt, too much salt, going to raise somebody's blood pressure?
Too much salt is very likely to raise somebody's blood pressure, yes.
So low salt diet, so you tell them not to, at least don't add any salt, stay away from Fritos.
Exactly. Stay away from salty things and don't add salt. And you're doing pretty good if you do that. Yeah. I want people to be physically active because exercise is helpful in lowering blood pressure, and exercise is helpful in lowering weight. And excess weight is a real key to people who have high blood pressure. Even losing 5 or 10 pounds will really help.
So we've got, if we're overweight, we should lose weight, we should be active. What kind of activity do you recommend your patients that are 45-year-old that's overweight and has got a blood pressure of 145 over 95?
Okay, well the good news is there are many different things people can do. I think you're looking mainly at aerobic activity, not weight training in terms of helping to lower blood pressure, but walking, bicycling, running, an elliptical machine, lots of different choices there. And it doesn't have to be high intensity, just needs to be activity.
Should we join a health club, or can we do that on the streets in front of our house?
You can do it on the streets in front of your house. But if you are more incentivized because you've joined a health club, that's a good thing. So I think some people do benefit from that.
So there's lifestyle changes that we can do. How about stress in life? You know, everybody has stress every day. Mm-hmm. There's always something that bothers somebody. So does stress relief help blood pressure?
It absolutely does. That's quite clear. It's just a matter of finding ways to effectively deal with stress, and that's harder for folks. But you know, stress will elevate your epinephrine levels and other hormone levels that are not helpful in terms of blood pressure. So if you can find ways to relax, that'll help lower blood pressure.
So we cut down on our salt, we get enough sleep, we laugh a lot, we lose stress, we exercise, lose our weight, and that really makes people healthier in a lot of ways. If the blood pressure stays up, so we've given somebody an adequate trial of lifestyle changes, how do you decide on what kind of medication?
Okay, well, good news is we've got plenty of choices there. And so we can almost always find medicines that are helpful and don't cause side effects, or at least not really bad side effects. So we can use diuretics, which are water pills. We can use what are called calcium channel blockers.
So what do diuretics do?
Diuretics actually help get rid of extra sodium and fluid in the blood volume, which then decreases pressure inside.
So if you put somebody on a diuretic, you expect their blood pressure to drop a little bit.
Yes.
Harmful side effects of the diuretic could be possibly?
Well, it can make you lose potassium, and it can make you lose magnesium, and that might be troublesome. It may lower the blood pressure too much, which we don't want. But for the most part, diuretics are quite well tolerated.
Do you start low dose? Do you start moderate dose?
Typically, you'll start low dose, especially in an older individual.
Okay, so we're gentle. There's diuretics. You said calcium channel blocker.
Calcium.
What's a calcium channel blocker? What does it do?
Well, it actually affects the amount of calcium that goes in and out of the smooth muscle cells in the arteries, and that helps to relax the arteries.
Are they good medicines for blood pressure?
Absolutely. The nice thing about calcium channel blockers is they typically are very well tolerated, and they're quite effective.
So they're effective, they don't cause side effects, or frequently don't cause side effects. Do you ever use a diuretic and a calcium channel blocker together?
Sure, that's a fine combination.
So next, give me another choice.
Well, there are what are called ACE inhibitors, angiotensin converting enzyme inhibitors, and they work by decreasing pressures that go to the kidneys, which gives a feedback that lowers blood pressure in the arteries.
And those are called ACE inhibitors.
ACE inhibitors.
Now, though, if I remember correctly, those are sometimes the treatment of choice if somebody has diabetes, because it does something to the blood supply to the kidneys. It protects somebody with that. And diabetes frequently is associated with high blood pressure. Is that correct?
You are absolutely right.
So that's a choice that we could can you start with an ACE inhibitor?
Absolutely. In fact, I would say I more frequently start with an ACE inhibitor than anything else.
Side effects?
So ACE inhibitors tend to be very well tolerated. They can cause a tickly cough, which is more of a nuisance than a real problem, but we'll stop it if it's enough of a trouble for someone. And they occasionally will cause the potassium level to go up, and occasionally they'll cause kidney function to worsen, even though ACE inhibitors by themselves are considered the best drugs for people with kidney problems.
So now we've got diuretics, calcium channel blockers, we've got ACE inhibitors. If the ACE inhibitor causes a cough or problem, is there another kind of ACE?
Yes, we switch to what's called an angiotensin receptor blocker. And
ARB.
ARB, that's exactly right. And those work much like the ACE inhibitor, but they typically don't cause the cough. And they've been shown to be very helpful.
So we've got a lot of choices. So far we've got 4 now beta blockers.
Beta blockers, time-honored group of drugs which are very useful. We use them somewhat less for blood pressure now than we used to. They tend to have more side effects than some other drugs. But they are very helpful in people who have heart failure, and so we use them a lot there. We use ACE inhibitors in people who have heart failure as well. And of course, you mentioned diabetes and ACE inhibitors. That's a perfect combination.
If one medicine doesn't seem to be doing the trick, do we increase the amount of that one medicine, or do we add a second? Do we add a third? Do we add a fourth? Do we keep on adding? What do we do?
Well, we can do whatever seems to work under the circumstance. And we have the option to increase the dose of a drug or to add another drug. We have found over time that adding smaller amounts of more drugs is typically more effective and better tolerated than simply increasing the dose of a single drug.
There's a new study that comes out of the National Institute of Health that talks about that systolic blood pressure, that 120, which when it goes high, it's elevated blood pressure. What does that study tell us?
Well, that study has not been published in its full form yet, but it will be very interesting to see what it says, to be able to analyze that, because that study says that lower blood pressures lead to fewer problems, which we would intuitively think, but we haven't had real good data that tells us exactly how far to lower the blood pressure. So this may be a game changer for us.
So if somebody has got high blood pressure and hardening of the arteries, if you bring it down too low, can you get problems?
Yes, and that's pretty clear. And we want to be careful, especially in the frail person. Oftentimes the older individual, but people with other health problems. And we know that if we lower the blood pressure too much, we may cause them trouble.
So good medicines, got to be careful. Home blood pressure readings are perhaps helpful. The best thing is in the doctor's office. You take it in the doctor's office, should it be sitting up or lying down?
Well, we do them both at times, but the typical place is to have it sitting.
Do you feel like the results of treating high blood pressure are successful in American medicine?
I do. It's quite clear that lowering blood pressure substantially reduces the risk of heart failure, also stroke, and kidney failure. And all those things are very important.
I think that's the big message. If somebody has a high blood pressure, Don't let it go. Be sure that you work out a problem with your doctor. He's got several choices. He can bring you back to good health, even though we might have to lose some weight and exercise every day. Dan Ely, thank you for coming to the Dr. Bob Show. You're a great teacher.
Thanks, Bob. I've enjoyed it very much.
Hope you'll come back and talk to us about other ways to keep our health good.
I'd love to.
Great information. Know what your blood pressure is. Know that if it's elevated, it needs to be treated. And we're getting smarter and smarter on the use of our medications. Now, stay tuned because we're going to be talking about the effects of a good night's sleep or not enough sleep. What can it do? And an elevated blood sugar, can it bother your eyesight or cause damage to the eyes? A lot of information for you. Want to stay tuned. I want to thank Dr. Dan Ely. Wonderful discussion on hypertension, its need to be treated, and the effectiveness of treatment. Now for questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob, how does diabetes affect the eye? Well, it's well known that people with diabetes can have problems with their eyes. And there are several things that it can do. There's called diabetic retinopathy, big word, but the retina, the back part of the eye, the blood vessels can change with diabetes, and they can change the nourishment of the back of the eye. The doctor can see that when he dilates the eye and when he looks at the back of the eye, and he can tell what's going on if you need treatment for that. Now, there are cataracts. There's an increased incidence. It about doubles people that have diabetes, doubles the incidence of having cataracts, so the lens may have to be replaced. People that have macular problems, that's the back part of the retina that has central vision, tunnel vision. That area, increased incidence, 2 to 5 times increased problems in people that have diabetes. So if you've got an elevated blood sugar, if you've got diabetes, whether it's type 1 or type 2 diabetes, it's a wake-up call. It's a wake-up call to get your blood sugar, your weight, your cholesterol, your blood pressure all under control. You've only got 2 eyes, and you want to look after those eyes because elevated blood sugar and diabetes can cause significant damage to the eyes. Question number 2, Dr. Bob, you always talk about a good night's sleep. If you're not getting good sleep, how does it harm the health? Well, people that have insufficient sleep, there's a direct association with obesity, being overweight. There's a direct association with people having heart disease. There's a direct association with automobile accidents, about the immune system not working well. So essentially, 7.5 hours sleep is an important part of your health and of my health. So we have to know how to get to sleep. We might need to be sure that we quiet down before we get ready to go to bed, that the room is dark, that the covers are the exact weight that we want, that the room is quiet, that we don't think about anything and we drift off into la-la land. You know, too often we don't have the opportunity of getting 7.5 hours sleep. There's something we've got to do at nighttime. We've got to get up early in the morning. We have problems with shoulder pain. We have problems waking up in the middle of the night, and we wake up and we can't get back to sleep. All of those things can produce harmful health. Elevated blood sugar. The insulin does not work as well. There's insulin resistance if we're not sleeping well. That causes us to eat more. We'll get overweight. We get high blood pressure. We get elevated cholesterol. It all leads, one thing leads into the other. So be sure that you're getting enough good, healthful, restful sleep. And if you're not, talk it over with your doctor. Very rarely do we need medications to help us go to sleep. Usually you can talk out the problems that you're having. You can correct them, and you can get that 7.5 hours sleep. If you find out that shift work or something is making it where you're not getting enough sleep, perhaps you can catch up on the weekend. Go to bed at a certain time and don't wake up until your body wakes you up. Well, that's all the time that we have for this show. Hope you've enjoyed it as much as I have. Remember, those 4 things that we want to do on the Dr. Bob Show. Number 1 is exercise. Exercise will lower your blood pressure. It will lower stress. It will make you feel better. It will help us lose weight. It doesn't have to be vigorous exercise. It's just regular exercise. Get that 7.5 hours sleep. It will make you healthier. There's nothing like 7.5 hours of good sleep. It'll make you happier. The people around you will be happier. And life will be better. Eat properly. You know, we're sort of marketed to eat improperly in our society. Remember to start the day off with a breakfast of fruit and fiber. It's good to have your cereal with low-fat milk and some fruit added to that with a glass of orange juice. That'll get you started in the right direction. As you go on during the day, it's okay to snack. Be sure that the snacks you eat are good foods. And try not to eat right before you go to bed. It's a simple way of gaining more weight. And most of all, what is it we like in the Dr. Bob Show? You know, it's that giggle and it's that laughter in your life. If you find somebody you love and you tell stories and you laugh a lot, there's nothing better for your health. It does help your immune system. It helps the people around you. So laugh a lot, and your laughter will make you healthier.